This is quiet.
Yeah, very quiet. Very quiet.
Something wrong.
This is really kind of,
Right.
Something's wrong.
are we waiting for fireworks?
Something ain't right. 2, 1.
I'd like to call the meeting to order. As most of you know, I'm not a board member. I'm County Attorney Ed Johnston, and I have the privilege once a year to preside, hopefully very briefly, while the board reorganizes itself. Tonight, Reverend Gibson has agreed to do the bow your head.
Would you pray with me? Our God and our Creator, we thank you for this day. We thank you for allowing us the opportunity to come together to discuss the business of this community and this county. We ask for your guidance and your direction so that all that we say and do will be done pleasing in your sight. Be with us, guide us, lead us, and direct us is our prayer. For it is in your name we pray. Amen.
Thank you, Reverend Gibson. I would invite everyone to join us in the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. By statute, in the December meeting, the board is required to organize itself for the coming year. And the first order of business to do that is the election of chair of the Board of Commissioners for the coming year. That being said, I'll open the floor for nominations for that position.
Mr. Attorney, I'd like to nominate Commissioner Whit Gibson for chair.
Right.
I'll second that motion.
Okay.
I'd like to nominate Mrs. Tim Ivy for chair.
All for a second.
Are there other nominations? All right. If it's agreeable to the board, I will do this in the same fashion that we have done it in previous meetings and do a roll call vote for the position of chair. The first commissioner to vote would be Commissioner Alford.
Which would you vote for?
Your vote for which candidate?
For the chair, Gibson.
Okay. Mrs. Golston,
Gibson.
Reverend Darrell Gibson,
Commissioner Ivy.
Commissioner Whit Gibson,
Commissioner Gibson.
Commissioner Ivy,
Commissioner Ivy. Sounds what they don't.
No.
Consent.
Commissioner McCall,
Commissioner Gibson,
Commissioner McFadder.
Commissioner Ivy.
By my count, Commissioner Gibson has 4 votes to 3 for Commissioner Ivy. Therefore, Commissioner Gibson is elected chair for the coming year. Congratulations.
Thank you, sir.
With your permission, I'll conduct the vice chairman election. Are there nominations for the position of vice chair for the coming year?
Mr. Johnson, I'd like to nominate the Reverend B.J. Gibson for vice chair.
I'd like to second the motion.
Are there other nominations?
I'd like to nominate John Alford.
Are there other nominations? There being no further nominations, I will declare
second the nomination, John Alford.
the nominations closed and conduct a roll call vote in the same fashion. Commissioner Alford,
Well, I vote for Commissioner Alford.
Commissioner Golston,
Alford.
Commissioner Reverend Darrell Gibson,
Gibson.
Commissioner Whit Gibson.
John Alford.
Commissioner Ivy,
Commissioner Gibson.
Commissioner McCall,
John Alford.
Commissioner McFadder,
Commissioner Gibson.
I believe the vote is 4-3. Mr. Alford is elected as vice chair for the coming year. I will surrender the floor to the chairman.
Thank you. Thank you, Mr. Johnson. Appreciate your assistance in the transition. Just a personal statement. I appreciate the opportunity to continue to serve as chairman. I feel like we've done some, even though we've not always agreed, as this election is also indicated, we've not always agreed on things that we've tried to accomplish in the last several months, but I believe we have approved some good things, and I look forward to continuing those good things in the future. At this time, we have an agenda before us. Do I have a motion to approve the agenda?
So move, Mr. Chairman.
Second.
I have a motion by Commissioner Alford and a second by Commissioner McCall. Any discussion? All in favor, say aye.
Aye.
Any opposed, say nay. The ayes have it. We will now have our public forum.
I do have some.
Okay.
Mr. Ramon Santiago on Old Stage Road, 13440 Old Stage Road, Gibson.
Okay, Mr. Santiago, if you'll come to this microphone. And I believe you are Ramon Santiago.
Yes, I am.
And your address again is,
13440 Old Stage Road.
okay, sir, you have 3 minutes.
Okay, my concern that I have today is the trash that's being dumped on the Old Stage Road from the pond there where I live all the way to Sydney Bean Road. There's a stretch of half a mile that is littered with adult diapers. It's an eyesore, and it's not only an eyesore, it's a health issue too. There's a lot of wild animals, and they'll come and they'll break up. They come all the way around, even the flies and the mosquitoes or whatever it is. So that's my concern that I have, that we have to try to get that cleaned up. I don't know who is the one that's dumping that stuff, but it's the same person. It's the same diapers and the blue bags. They keep on dumping it. And in the summertime, when the lawnmowers come around, all they do is run over it and spread it even more. And that's all the concern that I have.
Okay, thank you very much,
Thank
sir.
you.
Is that something we can get solid waste enforcement to go out on? And
I would think so.
Mr. Patterson, would you follow up with us after solid waste is doing that?
Mr. Santiago, if you don't mind, have you contacted the solid waste enforcement officer with the county?
No, I haven't, but I believe Ms. Golston, I emailed her to see if she could do something, but I didn't contact the solid waste. I have seen them before.
We're going to ask our manager, Mr. Patterson, to
do that.
to talk to the solid waste enforcement officer and have him probably get in touch with you.
That'll be fine.
Would you mind giving us a phone number?
Yes, sir, I don't mind. My area code is 910. My number is 384-3795.
Okay, thank you very much, sir. Any other, Ms. Robinson, anybody else for the public forum?
That is all I have.
Okay, I assume there's no one else here who is wishing to make a comment to the board. Hearing none, we will close the public forum portion of our agenda. We have a consent agenda. Several items on that. Is there a motion to approve the consent agenda?
I have a question on it before.
Go ahead.
that, and it's about item C on that record retention. Is that something that should be in the regular agenda, or I know we talked about it last time about coming up with whatever we were going to do. I haven't heard if anything was doing that, but I mean, this is basically the same one that we already approved back in March or May of last year. I don't have a problem with this reading, but I think we still have to address how we're going to enforce this or how we're going to retain this stuff.
Would you like to remove that from this at this
Well,
point?
I'm just asking if that's needed.
Part of it is, this is the state policy, and it's, you adopt all of it or none of it. But there is a definition that comes in here, that will go to the policy committee in their next meeting, which goes into reference value for determination. So that is going to the policy committee for that modification.
But I guess my question on it is the how or where, or what are we going to store it in?
Within the last year, we've also upgraded our email.
Right.
So now we are basically have unlimited server space, and we are using a vault to capture those.
But mine still goes
working.
away.
Well, we're still working. Our IT department has still contacted Google to figure out how to capture deleted. But they basically said, if you delete it, it's deleted.
Right. That's the part that I think we had to. But anyway, no, we don't need to take it off.
Okay. Do we have a motion to approve the items on the consent agenda?
So move.
Second.
Motion and a second. Motion by Commissioner Golson, second by Commissioner Alford. Any other discussion? All in favor, say aye.
Aye.
Any opposed, say nay. The ayes have it. New scat position. Good evening.
Good evening. So in your agenda packet, or in your packet, I submitted a letter. I hope you've had a chance to read it. So I came tonight to request a new position for SCATS, our transportation system for the county. My team showed up here in their bright new vest as well. So they're here. These are our SCATS drivers and our SCATS administrative staff and one of our administrators at DSS. Not to belabor what's in the letter, over the last year and a half, we've really worked to grow the SCATS program, which has had its own challenges based on COVID. Of course, people staying at home more, not using public transportation. We have seen the program grow, however, over the last year and a half. We looked at some numbers today just to make sure I could bring you some of the latest information. And even after I wrote this letter, since October, we've denied 108 trips for the simple reason that we don't have the staff to keep the buses on the road. We have the buses in the parking lot. We don't have the drivers or the positions anymore to drive the buses. All our full-time positions are full, and we are driving every day. And we have 2 part-time positions that are also driving on a part-time basis every day. We've really worked to increase our employment program. The county gets employment funds that we can pull if we're taking people to work or employment-related services. And historically, SCATS hasn't done any of that. So I'd like to pull that money, but you have to make the trip to pull the reimbursement back on it. We've also increased our Medicaid reimbursement significantly over the last year and a half by simply claiming the trips and getting the money back. That's 100% funding of the staff's time. Every time they take a Medicaid client to a service, that's 100% reimbursement on that time through the federal government. So I'll answer any questions about anything in the letter or anything else SCATS related. I feel very strongly a SCATS position doesn't cost the county $42,000. That's what's tied up in the position and benefits. Like I said, we get reimbursement, a pretty good reimbursement on SCATS positions. I can't give you an exact number because each driver does a combination of Medicaid trips, employment trips, shopping trips, and each come with their own reimbursement formula. So I'll be glad to answer any questions you
I
have.
have a question.
Yes, ma'am.
The new position, could that possibly include the SCAT bus to Wagram?
Yes, ma'am. And I should have mentioned that. When you, last year, about this time, you approved a new fixed deviated line, meaning the line that runs around town, like what we think about a true transportation system and stops. You approved that line, which included Laurel Hill, Wagram, and Gibson, and we haven't been able to start that line. We're kind of in this soft place of starting. We can't run it full force, and we haven't been able to get out to those communities. So this will really help that. as well.
I think what I hear you saying is there will be reimbursable funds that would pay the majority of the expense of the new position.
Yes,
And the position's about 42
yes,
cost,
county.
but you've increased the revenue $115,000 year over year.
Now, do these drivers for doctor's appointment, do they go out of county or just in, they do?
VA Center in Fayetteville, see Chapel Hill and Durham.
What do you use to make that transportation?
If we only have one or two riders, we can use a minivan. If they don't have a wheelchair, we don't have a wheelchair lift on a minivan yet. Otherwise, we're using a regular SCATS van.
You're having, okay.
And we do those on certain days of the month, so we can
Take more
make the
than
most
one.
of our trip and take several people at one time.
I move that we approve getting a new person for SCAT.
Have
A
a motion.
second, but I have a question
We have a motion and a second to add a position to scale
and a question.
discussion.
Do you think you'll have any difficulty filling it? I mean, what I read is that this is a skill that's in demand and lots of places don't have drivers in lots of different areas.
It is, and we have had that problem over the last 6 months. And most recently, we have now filled our positions. We've only been able to recruit for part-time. And we've had people come in and say, I really need full-time work. Right? I'd be right there with you, but I really need full-time work.
Okay.
And so being that we could only advertise for part-time might have been some of our issue with getting drivers. Because we have had people say that. So that may have been, but it is a challenge. They are required to have a CDL of a certain class. And so that does present a challenge.
Do they have to have the medical endorsement for the CDL?
Help me. No.
Okay. Any further discussion? All in favor of the motion, please signify by saying aye.
Aye.
Any opposed, say nay. The ayes have it.
Thank you so much.
Before you leave, can we ask all of your folks just to stand up and introduce themselves to us and the position they're in and maybe how long they've been with the county?
My name's Chanelette. I'm a supervisor for SCATS, and I've been here almost a year.
Almost a year, okay?
Name is Robert Jones. Been with SCATS about since the 14 and 17 years.
Wow.
My goodness.
I got the transit.
All right, thanks, sir.
My name is Michael Pitts, and I'm one of the newcomers on board. I only been about a couple of weeks, so I love it though.
All right.
My name is Elvis Gray.
Thank you, sir.
My name is Rudolph Baldwin. I'm from the SCAT Drive and work part-time. I worked here about 2 or 3 years ago. So I left and came back after they changed the system. I really enjoyed it. I think it's good for us.
Thank you.
My name is Robin Harris, and I'm a SCAT driver. I've been here for a year, but I was with the school system for 28 years now.
Mr. Chairman?
Just 1 second. Yes, ma'am.
One more.
I'm Joy Pine, and I'm one of the program administrators at DSS.
How long have you been with DSS?
Oh, sorry, 9 years.
Okay. Thank you. Thank you. Thank each of you. I thought I recognized a couple of you, but with the mask on, I wasn't sure. So go ahead.
Yeah. I wanted to stand because when I retired from Abbott, that's what I did. I drove for SCATS and I enjoyed it.
Yeah.
I did the trips to
I didn't know that.
Duke and to Chapel Hill, and I just enjoyed it. It's a good job, fun job.
We appreciate what y'all do. Thank you so much.
Thank you.
Thank you, Ms. Neat.
You drove a bus.
I'm not trying to get rid of you. We love you to be with us. We think we're better when we have folks here, but we realize you may not want to sit for the next hour and a half of this meeting. You're obviously welcome to leave whenever you choose.
Not you. Not you.
Livingston's Quarters Recycling Center property purchase.
The lease, it's a multi-year lease, but the lease on Livingston Quarters is up. Last time it was up, the owner was not interested in selling at that point in time. But this time they are interested, or they were open to selling the property to us. We currently pay, a lease that I can guarantee you will go up. The area that we're looking to acquire is the yellow highlighted spot. It is just under 4 acres, 3.57 acres on what I measured, subject to a survey. ZB Pate currently owns the property. They said that they would sell it to us for the same price per acre as they sold us the Sneed's Grove facility several years ago, which comes under just under $20,000, which solid waste can absorb in its current budget, its capital budget. This would mean with this, Scotland County would own all the convenience sites that we currently have. And this also provides enough space to do some minor improvements that we are already looking for doing, and also some additional space that would allow for future improvements if necessary.
Who owns the property around it? ZB Pate?
ZV Pate owns everything to the left of it. Those to the right are along St. John's roads are different private individuals.
Okay. How much were we paying per year on the lease?
The lease that's ended is $150 a month. I have a feeling that's going to go up. No, they haven't increased it. It has not been increased in 20 years.
Kevin, I noticed that you're suggesting a survey, which I think is a great idea, but how long will it be before we could get that done?
I'm not sure exactly how long it would be, but we do that after board approval.
Right.
So, but with that, as long as we approved and started working on the process, Bates has no concern about going month to month on the current lease until we close.
Just know that there's a backlog on surveying right now.
And that may be something that we can work on, depending on the timing of the survey, because we know what the description could be, but we can develop a legal description. also.
Well, it's a per acre price, so it's dependent on the amount of acreage in the survey.
Right.
You've heard the presentation from Mr. Patterson. It's the pleasure of the board.
I move we approve the purchase of that land.
Second. Have a motion and a second. Any further discussion or any questions? Yeah, hearing none. All in favor, say aye. Aye. Any opposed, say nay. The ayes have it. Thank you very much.
Representative Pierce did say he would not be able to be here at 7. So that's why we put him a little bit further down. Suggest we delay that until.
We will delay that until he comes. We'll skip to item number 5, I.A. Johnson.
Refer that to the committee members.
Oh, it had your name.
It's your office name now.
Well, we're still pending. I guess they're still working on the memorandum of
Understanding.
thank you. And then the deed would come shortly after that because they wanted that. I will say at this time though, to remind everybody here, and I think Commissioner Gibson sent it out, about Thursday night at 7 o'clock at the IEJ gym will be a community meeting or community input as to what goes on there. So
Thursday at 7 at the IJ at the
Thursday
gym,
at
I
7
believe.
at the gym. Yeah. And, well, I'll let you talk about the love project. So I was going to mention the love project.
Go ahead, Jess.
Well, I went out there Saturday morning and wow, it was more than what if you had not had that facility, there's no way around, they would have done it around here because it was just, the hallways were full. The gym was absolutely packed. The stage, the bathrooms in the back were full of bicycles. I ain't never seen anything like that. And I don't know how much they got rid of it all or what, but
Most of it. There's still some there.
but it was a good thing to see. And a ton of people there volunteer wise from not necessarily, there were local people there too, but there were a lot of people there from out of state, Pennsylvania,
That's great.
Tennessee. I mean, they were from all over. So
I heard people talking about it during the parade, how wonderful it was that IEJ could be used for such a project. And my hats go off to the committee because without you, it would never have happened. So it was, according to the people, it was a wonderful experience.
I would just like to say to those of you who may not know, I serve on the South. It used to be Full County, the Southeastern Partnership, and we held one at the community college, and there were over $3 million worth of giveaways there. And finally, the state patrolman had to shut it down because it had 95 backed up. So they're very successful. You said you just have to have a site because people really line up, and it's good that we had that site. Otherwise, couldn't have had it because there'd be too many cars. So maybe, but they had a where it's located, people could line up, and so. But there was over $3 million worth of free new stuff, good stuff. It's not hand me down. This was very good.
Can I ask
I
a
have
question?
a question for the three of you. I remember our community meeting up in Laurel Hill almost 2 years ago and how we had a facilitator and people broke into small groups and all. Are you anticipating having that same format?
yes.
Good.
And Parks and Rec's actually going to direct that. The
Oh,
Parks and
okay.
Rec staff are going to do
That sounds good. Okay.
Mr. Johnson, I think had a question.
I would like some direction from the board on one component of what we're doing, and that would be, again, does the board desire to have a survey done in conversation with the attorney for the schools? It appears that, and he's trying to track down what they have, but it appears that if there is a survey, it's a very, very old survey, and he's not sure they even have one, but he's trying to piece together what they have for a deed. He did indicate that they had a survey done on North Laurinburg School, which was very helpful to them. And they don't have any interest in paying for a survey, but I think it might be beneficial to have one, and it would be up to this board as to whether we have one done or not. Of course, that will slow the process down, but
But if we can go ahead and get that started even before the MOU, or at least get that process started as the MOU is being drafted, that way it may not extend the deed and everything else.
And imagine it's a difficult survey. I mean, it's
Well, we-
plotted out. It's pretty much square. I'm not saying not to do it. It just doesn't look like one of those weird angle surveys. It's got to be,
and there may not be, but I think, there may be things that you discover via a survey that will not show up on a title.
I agree with it.
And,
I don't think it would be difficult.
Yeah. Of course, we don't want to do the deed until we have the survey to use to prepare the deed.
Especially if they're having problems getting the deed together.
I suspect they have some very old records they're going through.
And that was why my understanding they had to do North Laurinburg was because of that deed issue.
That was the main point I think he was making with me when he was
Right.
talking about North Laurinburg.
Doesn't sound like we got much choice in that. So.
I think we ought to have a survey if we're going to draw the deed. So would someone like to make that motion?
Do we need that as a motion? Do we need that as an action? That's a question. I'll make the motion. We have the survey done for the Ellis Johnson.
I think we would need a motion. So we got a motion and a second. Any further discussion? All in favor, say aye.
Aye.
Opposed, say nay. Ayes have it. Thank you, Mr. Johnson, for bringing that up. anything else on IAJ at this point? Laurel Hill Community Center.
I would like to go back and say something because not sure who did it. You may can tell a little more on it, but they had cleaned up that school. That thing, it was clean. The tables were in place. I mean, it looked like a totally different. When I went in there, even with all the stuff in the hall and in the gym and all, it really looked. I don't know who all contributed. To that.
I'll share. I'll start out with hats off and thanks to Kevin Patterson and Public Works. They went in and did a lot of work early on. And then one day, well, every day, Miss April Sneed and DSS staff, they came over and spent hours working. Myself, Pastor Faye Coates, and Denise Riggins organized volunteers from our area churches, from the Restoring Hope Center, and from Church and Community Services. They went in. We spent what, Miss Sneed, Wednesday, Thursday, and Friday. I think unloading and sweeping and mopping, and we were even over there today doing some work. And gotta go back in the morning because we still have some clothing left and some non-perishable items. And so we're working to still try and get that out. But those are really the main people who did a lot of it.
All that's going to.
All of that that's left is left for our community. And it's still a good amount. And so we're going to organize or coordinate for people to come in by appointments. And then what's left over, we're going to split up between Restoring Hope, the local NAACP, Church Community Services.
Yeah, sounds like it's
and Concerned Citizens for the Homeless.
Okay.
sounds like it's been a good community effort.
It has been amazing.
I was impressed by how much was.
It was amazing. We serviced well over 1,500, at least 1,500 families on Saturday. I got there at 5 a.m. and we already had a line at 5 a.m.
Can
Wow.
you give us some idea of what some of the things that were available?
They had any kind of food you wanted. Drinks, cereal, just all kinds of food. There were clothing. And some of the stuff was gently used, and there was also new stuff. I think, April, my number, we gave out about 300 bicycles. There were toys. There were household items. I mean, people were able to take, it was furniture that was donated like you would donate to Habitat, but it was I saw people with 6-seat dining room tables that they were able to take. Beds, recliners, couches, lawnmowers. And the way it worked, when they came in, we gave them a shopping cart. And the word was, if you see it and you want it, it's yours. There was no limitations to what they could have. And so
Everybody fighting over stuff.
we had absolutely not one hiccup, not one complaint.
There was too much there to have to fight. I mean, it
I
was.
said that sort of legit.
I know, yeah, people left crying. They left in tears, just so thankful for what all they received. And so it was, and as Commissioner Ivey said, we had people who came from Pennsylvania, New York, New Jersey, who drove in just to volunteer and help.
Did they have mattresses?
No, I just saw a lot of bed frames.
Yeah, I know a lot of times that's a difficult thing to.
Yeah, mostly
Yeah,
bed frames.
That's great.
You
That's
can't even
great.
give a mattress away.
It was amazing. It really was.
Yeah. Okay.
And also the Laurinburg Police Department and the Sheriff's Department also helped in that, I believe.
Who's that?
Laurinburg Police. And
They did. They helped even providing security overnight each night. There was somebody each night, one from Laurinburg Police Department one night and Sheriff's Department did a night. They helped with traffic, and it was a major community effort. It was.
Will this happen every year?
Not here.
Okay.
This was the 11th year that this organization does it, but they go to different states every year. So we were blessed.
But it was Church Community Services and Restoring Hope Center. They were the local heads
Right.
in coordinating this effort.
Right.
And that was an incredible task for them to do.
Yeah. It was a lot
BJ,
of
if you
work.
know, how many places do they do that in a year?
Just once a year
But just in one location?
in one location on the first Saturday of December. They go somewhere every year,
They'll be somewhere different.
somewhere different next year.
We were very fortunate to have been
We were
selected.
blessed. Yeah.
Absolutely.
Fascinating. Yeah.
Thank you for your part in it.
That was wonderful for the county, really.
Okay. Mr. Patterson, Laurel Hill
Okay.
Community Center.
Laurel Hill Community Center, if anybody's gone through and started looking, they are working on the pad. They have started digging the foundations, and then they are scheduled to start laying the underground material in place. A copy of the schedule is in your file, but with my last meeting with the contractor, he did say that he's hearing that the building may be pushed back into March. Depending on what that is, he will send me a modified schedule. So I've not received that updated schedule yet. But our next construction meeting is the middle of December.
Okay. Any comments, questions? Hearing none. Commissioner Goldston? Board committee?
No one is want to be appointed to any boards.
Commissioner Golson, do we have any vacancies though?
No, I don't know the answer to that. I will have that, Jason. Do we have it?
I'm sorry, Jason, I did not hear you.
There's several on the website. I know that our perpetual one that we always have is
Extraterritorial was,
The what?
the Laurinburg ETJ zone. That's been open forever. I've had people apply, but they don't meet qualifications. Leave it within a mile of that.
There's a couple with the historic properties too, right?
Historic properties, there's two in there. Agent advisory, I think there's one or two. I know that the dentist component on the health board is not vacant necessarily, but it's up for reappointment. So it's on there.
Thank you, Jason.
The COVID-19 update. Dr. Caldwell?
Let me get this one.
Okay. Let me get a couple of slides up there. The first slide is just cases that we have seen here since the beginning of the virus, and some of the breakthrough cases we are also seeing. As of today, we have about 5,960 total number of COVID cases, and those who have recovered is about 5,815. Total death is 110, and active cases is about 35. School age is about 5. Breakthrough cases is about 124. And the red map on the right-hand side of the screen is just telling you that almost every county in North Carolina is now reporting high rates of the virus. A few weeks ago, we were in the moderate to low in Scotland, but I guess that changed because of the post-holiday season is always predicted, because normally when people get together during the course of this virus, we expect change to happen, and that's exactly as of today, based on our local data, we do know that we do have about 7.2% that is in the yellow. That places us in a moderate based on the local data that we have. But again, if we do calculate that by 100,000 per 100,000, we are still in the high risk category. And then one of the things we are seeing again in the data is that hospitalization is going down, even though we are still in the high risk category. On the right hand side of the screen, the 7-day moving average. In the past 7 days, I think the number of patients that have been admitted to the hospital is about 4. So it's kind of getting to stabilization. That's what we are seeing on there. Okay, move to the next screen. That's the vaccination progress. We've been seeing some increase in vaccinations and then some stabilization also in vaccinations. What does that mean to us is we are still kind of considering the data on that to understand, because as of today, about % of the populations who are fully vaccinated, or partially vaccinated, 12 years of age and older is 59%. Fully vaccinated is 55%. I'm not going to go through all this because you can see that on the screen. But the trend in the data, what we are seeing here is, I guess what we are having a little problem with is ages between 5 and 11. So we are seeing less than 2% of that population is vaccinated. So I guess we need to re-strategize and see what can we do to bump that up. So in the next coming weeks or so, our focus is going to be on school kids between 5 and 11. That's where now we're seeing that vaccination effort has to be focused, because that's the population where the lower number % of the vaccine is. Less than 2% of that population is vaccinated. But again, this number is encouraging because 25 to 49 age cohort, about 42% of that population is vaccinated. And 75%, 84% of the age cohort, 75 plus, is vaccinated. That is also good. But I guess, again, we have to more focus on 5 to 11, which is less than 2% of that population vaccinated.
Dr. Caldwell, you made a comment and I just didn't understand it. It was the other slide was up when you did. What did you say about the hospitalization rate?
So that rate is much more stabilizing. So we are not seeing too many people being hospitalized. And there's a reason for that. One of the reasons we are seeing for that is because the rate of vaccine is going up. And also we are saying that one thing for sure we know, the masking is working, the vaccine is working. So we are seeing difference in that. The more people we get vaccinated and the more preventative measure that we take, the less likelihood that we'll see people go to the hospital. And then one of the scenario we are also seeing is that people are referring to these things as breakthrough cases. When people get vaccinated and then get sick, they are less likely to go to the hospital. In the past few months, before we get to the place, we know that Scarlet Memorial Hospital was overflowing by patients. That was one of the reasons for that, was because we had less number of the population that was vaccinated. But now we do know that a good number of the population is not vaccinated. So, and one of the reasons why you are seeing that rare map is because the way CDC do their calculation is they are not just looking at the daily positivity rate. They are looking at a number of they're looking at the number of people who are positive per 100,000.
Right.
So when you do that calculations and looking at some of the counties in Scotland County, the population is less than 1,000. So most likely you are likely to report high cases. But when you do the numbers, or if you calculate based on positivity rate, that is less than 5%. So technically, we are in a low risk category. But because CDC is looking at 100,000 per population, then that still places us in the high risk category because we do have small number of the population here. We are just 35,000 here in Scotland. So that's the reason why we are still seeing that red.
So there's 2 people in the hospital right now.
I think it's 4
Is that
per week. Weekly we are seeing, so say it
is
again.
that just the county residents or is that at Scotland Memorial?
Scotland is both. When I talked to their chief operating officer today, according to what I learned, they were looking at 5 since last week. 5 to 6 people has been hospitalized for the virus. So the numbers are substantially.
But that's in
decreased.
their entire Scotland, Marlborough, Robinson.
Exactly.
Okay.
Yeah. But CDC is reporting on a 7-day rolling basis.
Right.
Which is very much encouraging because that used to be more than 20 per week, but now it has come down to 4. And part of the reason is an indication that 2 things are actually playing in here. The vaccines are working and then the mask is also working. So when you vaccinate and then people get a virus, because there are 3 things the vaccines can do. It can prevent severe cases, it can prevent you from death, and also it can prevent you from being hospitalized. So that's the evidence that the vaccines are actually working. And then the other thing the mask can do is it can actually prevent people from spreading to another person if they get the virus. So there are a couple of things working together here synergistically to prevent max number of people going to the hospital.
So Dr. Caldwell, I think the ultimate question is what is your recommendation as it relates to mask requirements since our numbers are looking so good?
So actually one of the maps I wanted to show is this map here. And excuse me, I just want to move a little bit. If you can see here, this is Scotland here. So in the region here, that is reporting about 100,000 per cases. So we were even doing better before the holiday season. Scotland is the only county in this region here that is doing far better per 100,000 cases. And the reason I'm bringing this up is because I really want to say on behalf of the people of Scotland County, thank you, commissioners, for the gift card that you approved. I know they may sound like, but it makes significant difference. One of the things about that is the booster shot, right? Because I've been working on this for some time. Vaccines really work. One of the things the booster shot can do is about preventions of reinfection. And then if reinfections are prevented, it also stops people from going to the hospital. And that's why we are saying that the hospitalization has also dropped significantly because we have seen good number of the population get the booster shot. So, and most people really got a booster shot because the incentives were there. So they came to get a booster shot because they were getting the $5 incentive gift card. So there was a kind of, if you look at it, there was a relationship between getting a booster shot and then getting the incentive card. So we did establish that relationship that it make a significant difference. So that's one of the reasons I'm saying thank you for that, because we saw that relationship between the incentives and the booster shot. And this last,
am I reading this right? Are somebody testing the wastewater for?
The waste, that's the waste. So the wastewater surveillance system is just one of the things that we use to be able to monitor how the virus gonna circulate in the community. As of now, actually, the COVID activity in the wastewater in Scotland, Laurinburg, has plateaued. So that means that if you see December, because said in September, for example, that plateau in September. Now going back to December, so wastewater monitoring, we don't see that the significance of COVID spreading. So one of the things I was trying to do was to run a model to see going into December to January, but because of our internet, I wasn't able to run that model to show you. But if we move to December to January, one of the things we are going to see, if we can encourage people to wear the mask, take the vaccine, even if we're not going to see that, if the map is still red, we're not going to see that people get more sicker or go to the hospital as compared to the previous past. So because this one, number one, this one has stabilized, it has plateaued. And then number two, the number of cases per 100,000 is not going beyond 200. So those are kind of metrics I'm looking at. And then the positivity rate also for the past 3 weeks has been below 10%, even though the cases per 100,000 is also 100. So those are different things I'm looking at. Unless, because we are staying in the holiday season, so I have to be, like I always say, I have to be cautiously optimistic because we are staying in a holiday season. But even with that, if I do run a mile tomorrow and see if anything changes, I always like Kevin know that this is what I'm saying. And then I'll move on to the new variant, the Omicron variant. So those are the states in the United States that are now reporting the Omicron variant, the new variant that we are talking about. And the clinical characteristics of this new variant, preliminary data has shown that we have not seen as the daily characteristics of the Delta variant compared to the Omicron variant. But I guess one of the data I'm looking at is I'm trying to compare people who are vaccinated and then get an Omicron variant, and then those who are not vaccinated and then get an Omicron variant, and compare those two data and see and look at the clinical characteristics of those two populations and see whether the Delta variant is much more deadly than the Omicron variant. If that is established, then we can be for sure know that Omicron variant is not deadly. But as of today, scientists are not sure yet. So we're still observing that.
But there's still nobody been hospitalized.
When I was looking at clinical data for South Africa, people have been hospitalized with it, but it has been mild symptoms. So it's not been
but nobody here has been hospitalized.
Exactly. It's been mild symptoms.
Is anybody in North Carolina with it yet?
Not yet. So this is a map.
Probably is. They just don't know.
Oh, nobody. Yeah.
Probably is. They just don't know it.
Did you
Exactly.
get an
So
answer?
and the sequencing continue because it could be circulating. But one of the things we call genomic sequencing until the sequencing is done, for sure. Oh, okay. So, and we are a little bit behind. The United States is a little bit behind in terms of genomic sequencing compared to Israel, for example, or South Africa, for example. So we are a little bit behind with that. But as we collect more data, we can become more familiar with the clinical characteristics of the Omicron variant.
Dr. Caldwell, I think maybe Commissioner BJ Gibson asked, and I'm going to ask a little bit differently, but do you or have you had any conversation with the hospital administrator, Greg Woods? Do y'all have a recommendation to us about continuing the mask requirement that we've had for the last several months?
My recommendations would be yes. The previous map, I would say yes. And I try to get in touch with Greg Wood, but he's not in office today. And I guess what I'm trying to say is I'm just trying to be a little bit cautious here because one of the things I'm being cautious with is because of this Omicron variant, we don't understand it yet. So, and I don't know for the next 2 months or so what scientists are going to say about this variant, what it's going to be. So yeah, so I don't know for sure. So I can't say much more. I can't say a lot about it. Cool. So yeah. My recommendations would be at least month to month. If for sure for next month we can have more data, understand it. And another thing is looking at, because we are still in the holiday season. If for sure New Year come and go, and then we know that for sure the data is saying something different, and we see the reality on the ground, for sure we can really say, yeah, we can do away with the mask mandate.
It seems to me that the numbers are considerably lower.
Of course.
If you look at the death rate, we were averaging 6 or 8 deaths a month back several months ago. And I think we've had 4 deaths in the last 2 months.
I know probably when this is what you're going to be calling me the max man, but no, but I'm just being a little cautious because if let's just put this on the watch. If this is going to be like this month, December, January, probably we can see something. And yeah, I'm just trying to be a little careful here.
But is there a recommendation from board, anybody?
Mr. Chairman, I would make a motion based upon the recommendation of our health director that we extend our state of emergency until January the 7th.
We have a motion by Commissioner B.J. Gibson, a second by Commissioner Goldston. Any further conversation?
Well, and I asked this question last time about the health department. What does our state of emergency or whatever have that's got teeth in it? Because, I mean, you know, to me, it's a worthless piece of paper because there's nothing you can do about it if somebody doesn't follow it. To me, you tell people, here's what you should do, here's what you can do, and you leave it up to them and get this state of emergency umbrella off of them. But because they're either going to do it or not going to do it, it don't matter how many of these you issue. And so I've gone along here for the last couple months, but I think I'm to the end of it now. I mean, we've only got a couple people in the hospital. We haven't had a death in over a month in it. And at some point, we got to let people take responsibility for themselves.
And I don't disagree with that. My sense would be that we continue it through the holiday season. And if the numbers are still going in the direction and kind of where they are now, I would join with you on that a month from now. We have a motion and a second. Any further discussion? All in favor of the motion, say aye. Aye. Any opposed, say nay.
No.
The ayes have it. Thank you, Dr. Caldwell. We are going to go back on the agenda to item number 4, I believe. Our representative, Garland Pierce, is with us. Honorable Garland Pierce, we appreciate you making the effort to be with us tonight.
Delighted to be here with you tonight. I had another meeting and I was trying to get here as soon as possible. I'm just delighted coming before the county commissioners tonight and just discuss a little bit about the state budget. I think many of you are well aware of the budget that has been passed. It was a bipartisan budget, Democrats and Republicans joining together. It was time for a budget, no doubt about that. We've gone many years without budgets, and I think there was the benefit of a budget this year was something that we can all agree with. And I'm just delighted to have been one of the conferees that actually voted for the budget on the first time. That allowed me to have a seat at the table to discuss the budget with the speaker, with the governor's office, and all those involved. And because of my involvement as a conferee, the benefits that this county will receive, and I think I've sent it to the chairman and to the county manager, the process that one has to go through to get those funds. The city government knows about what they need to do to get there. Almost $1 million for the North, for the fire department. And also the county has 2 items in there, IEJ, $500,000 and Law Hill, $500,000. I'm very careful how I choose my words tonight, but that did take, I appreciate those who were able to come up that day. Brother Gibson came, but I think as soon as he walked in the door, he had a family emergency, so he had to leave. But I want to thank the rest of you that really showed a lot about Scotland County being at the table. And I think those of you who were at the table knew once I agreed to support the budget, that's when the speaker stepped up and was willing to, he was amenable to honoring the request that the county brought up. If I'm fortunate enough to go back again, it's all up in the air, but I don't know what happened in the process when I first sent the request out at the first of the year. I won't blame anybody. Definitely won't do that. But I'll make sure everybody from here on gets my mail, and I'll follow it, make sure you get it, because I really believe had we got out there a little bit quicker, we could have got more. But I mean, if y'all was satisfied, I'm satisfied. But I think we really could have got more, because it was in that part of the process where the speaker was, willing to do things, and I think he did. We got the $25,000 for the Literacy Council. So that, because I mean, as I said in another meeting, they're in area of wanting to close down due to not having money to operate the Literacy Council. So the 25,000, I hope, will give them a jump start. And because it takes $50,000 a year to operate the Literacy Council, I still think there's a need for Literacy Council here in Scotland County. We still have a lot of adults and others who just do not have the skills necessary to read and do a lot of other things. Some just to read the Bible or just the newspaper. So I think we'll do well if this body at some point maybe consider helping them out. But we are well aware of the broadband in our county and what this budget will do for broadband. We'll be able to reach out into our areas. We know what we had to do with school buses. This time when kids were doing their work, we had to park buses in a lot of rural areas, having to park buses because there was not broadband. So this budget has, I don't even know the amount of money, but they had a lot of money to expand broadband in our rural areas. So that's going to be a win-win for us. The other items that I have been a part of as it relates to some economic development issues, and I don't think they're for public discussion tonight, but I have lent my support and my voice to some issues, some things that you guys might have more knowledge than I have. So I want to let you know that I have tried to work full well for this county, do what I could. Being a long-term legislator, 17 years, it makes a difference with seniority. And I think I have a great relationship with the leadership in the House. And I hope that I've shown by my ways and actions that I've been able to speak for this county. There were times we did not have these opportunities with this in budgets before, a particular Democrat, to do things. But I think this time, due to the fact that it was a bipartisan bill, that I had the opportunity to lend my voice. And I hope that the $2 million that came to the county and the city will be a blessing to the work we're trying to do. So I want to thank y'all for coming up that day. You all had a chance to sit down and look the speaker in the face. And I think on that day, he kept his word. He agreed to do just what we asked him to do. So I'm just delighted. If there's any questions, I'm more than willing to share with you. But whoever serves the next time around, whoever, make sure you get to the table early with things you might want for the county, because that's just the way it works. And whoever that might be, that's up to whoever. But get to the county, because there was a lot of things other counties got that I just still believe we could have did better. But I'm just grateful and thankful for what we did get. It will make a difference in the scheme of things. Yes, is I'm all right to address?
Really appreciate.
Is that all right?
Yes, absolutely.
Really appreciate you coming, Representative Pierce, and please try to come see us every once in a while, because to give us information about what's going on and help us remember, things that we need to do when we need to do it. Okay, and that will help a lot.
And I don't think y'all are not knowledgeable of those issues, but when y'all doing what y'all do, and I'm happy to do that in the state, but I think there's a saying in Raleigh: if you're not at the table, you're on the menu. So I want us to be at the table always to discuss.
Make sure we know when to come.
Yeah, there you go.
So you have one of those big checks you're gonna present us tonight?
I don't have it, but I can get one made and come back another time. Don't worry. But now let me go back to what I said. There's a process.
I know.
Mr. Patterson, you know about the process.
He's sitting that out.
Have you ever did that before? If you don't mind me questioning you.
Not under a direct legislation such as that. No, sir.
Okay. So you never have.
No, sir.
So it'd be new for you.
Yes, sir.
Okay.
Representative Pierce, we appreciate all you've done for us this year and in the past. I know recently you got involved with one of our projects, economic development, and I know that is going to, I believe, will prove fruitful. We appreciate your effort on all fronts, but particularly on that one.
Okay, thank you. I'm glad I was able to lend my voice to that. I didn't want to discuss it in public tonight, but I was glad I was able
I
to
do
lend my
commend
voice.
both the Republicans and the Democrats, and include the governor.
Yes, sir.
We've been without a budget for too long. It
Yes,
was, I think the public was impatient that group come to some agreement. I think it was a good thing that occurred.
Representative Pierce, go ahead, Commissioner Alford.
I just personally want to thank you, Representative Pierce, for what you're doing for our state and more specifically for Scotland County. I really appreciate it. That 500,000 for IEJ and Laurel Hill and Literacy Council, that's important. And everybody already know this, but freshman representative couldn't do that. It takes seniority to do that. And thank you.
Glad to be of assistance to the county. For Gibson.
My goodness, it almost slipped me. Oh, okay. One question. I know you mentioned the two 500 for IEJ and 500 for Laurel Hill. Was there 500,000? Yeah. Was there not another 500,000 approved in the budget for something for Scotland County?
You might, and
I thought there was an infrastructure, but I may be wrong about that.
I think I won't call him by his first name, but I think Senator McGinnis was able to get something for the
Okay.
dam out there.
That why it was an infrastructure. Okay.
Well, that's why I asked, because I never heard any details as to what it was in relations to.
I didn't study that part, so but I knew about it. But he was able to get that to remodel the dam out there behind. You drop down to the bottom of the hill, about there by Trinity Presbyterian Church. The dam broke some.
That on Blue Farm Road.
Yes.
It broke. There's 100,000, I think, to help repair.
Yes. Now that was 100,000. Now you said something about another 5.
There was a 500 that we received in an email.
Senator McInnes, I believe, is coming in January.
Yeah.
I think it was just listed as infrastructure. There was another 500.
Oh, I thought so.
There was
That's
a
$100,000
$550,000 infrastructure. I think that Senator McInnes.
Yes. So it was a win-win for the county. Okay, how you look at it. That was a win.
Yes.
I would say this, there were some rural areas did not receive anything, no more than just what the budget will give them, but no special projects. I guess you guys already know, that's what they call pork, so. It's just pork, so grateful for that.
Any other questions? Thank you for making.
Thank y'all for allowing me to come.
Thank you for making the effort.
Thank you.
You like pork when it's coming?
Yeah, don't like pork going the other way. That's right. That's right.
County Manager's report.
Okay, a couple of things. First of all, and this is in the U.S. House, House Bill 5735. There's the name of the bill. This bill has already, the Senate companion has already passed unanimously. And currently there are 121 co-sponsors in the House for this bill. This bill focuses on the ARP funds and allows greater flexibility in two areas. One would be for transportation, but the other aspect that it allows up to $10 million of a county's allocation can be used for general government purposes. And our allocation is $6.7 million, which means it significantly reduces the restrictions that we would have for these projects. We've been trying to figure out how to peg some of these funds into the different federal and state restrictions. Basically, assuming this passes, and I have no doubt it will eventually, basically, it would allow the board to allocate those funds to anything the board can legally allocate funds to.
So we're not getting more money.
We're not getting more money.
But
it
Frees up what you do have.
yes.
It loosens up.
Yes.
We all, or I got an email today from NACO about this, about talking to your local rep and to DC about it. So you may want to look in your email.
Well, remind us of what we have allocated so far. Can you do that just like a napkin figure?
Yeah. Right now, amounts that we have allocated but not encumbered are about $2 million.
Okay.
Amounts that we have encumbered were for the vaccine incentives, sheriff's department, incentive pay, funds for Church Community Services to do homeless prevention and utility assistance. And the Scotland Health Clinic. Those have been encumbered, which means we have actually either written a check or the board has officially said we are doing this with these funds. Thereafter, there are funds where we've just given general outlines. But right now, we've not even touched over $4 million in theory on some of these funds.
What did you say about the sheriff's department in that first statement?
The incentive pay that was approved in the budget.
We were able to retroactively apply
Yes.
the COVID money to that. Okay.
Yes.
Because I've had some conversations with county employees that were wanting to know if additional budgets of additional bonuses might be forthcoming for them from this amount of money. It may be something we can talk about in January.
But there is the ability currently for incentive pay.
Mhm.
But if this passes, it becomes a lot simpler.
Right.
Kelvin, when I see the word Disaster Relief Flexibility Act, I see the word disaster relief. If there's ever anything we can do about situation that we dealt with during the last flood, and those homes that were underwater, and I always wonder, is there anything the county can ever do to keep these kind of things from really happening in the county? I mean, the flood situation in some of these areas. It's keep on happening if we keep having flood.
The simplest thing to do, and it's also the most dramatic, would be basically go in and look to condemn the homes and consider them floodplain. If they are in an actual floodplain, condemn the homes and basically make it unbuildable land. One of the things to it is we had during the last hurricane, we had a number of houses that were flooded that were not in floodplains. So it was not reasonably, it was, no one would have predicted. With that, there is also the possibility in some of these, especially the flooding inside the city of Laurinburg, some of these funds could go into their stormwater. But when you have that kind of event, any stormwater system is going to fail. But with the additional flexibility, there could be additional items if there were targeted areas, we might be able to bring somebody in and do some suggestions for. And, depending on exactly where we were looking, it might be as far as going for hazard mitigation. And with this flexibility, it opens it up because under the current rules, we can do certain hazard mitigations, but it also has to qualify under HUD programs, HUD or watershed programs, which if you're not talking about a flood zone or designated wetland area, it makes it more complicated to do the hazard mitigation. But with the additional flexibility, we can look at doing some targeted hazard mitigation.
Okay, because it's so hard to look at people in such dire distress and nothing we could do with it. And I know that, probably areas do need to be condemned and all that, but do y'all ever have meetings about this kind of thing, this disaster relief situation in this county?
Actually, we have regular disaster preparedness meetings But that, and I was on a webinar today talking about hazard mitigation or hazard mitigation plans through federal. Well, basically, they were talking about wetland. They were talking about soil and water conservation areas that we can do for mitigation, primarily for flooding. So the federal government is doing a new program for that as well. So
And I would assume that when they're talking about localities, it would mean a county entity or a city or even a school board, a school system. Okay. So they all might have that increased flexibility.
yes.
Okay.
And so with that, I would recommend that board members, as Commissioner Ivy suggested, there's going to be more information from NACO, and also if you would reach out to Representative Bishop in support of this. In your packet, there are a list of 61 parcels that we have acquired through foreclosure proceedings. And actually, I would ask that the board surplus these properties so that we can take these and have a public auction. I've already sent this list to, or majority of this list to Iron Horse. Some of these properties were actually finalized. A significant number of these properties were just finalized last week through the court system. So we actually don't have the full deeds yet. But the board approves surplusing these. We would auction them off through Iron Horse, targeting the 1st of March.
You do it. You're sending 60 to Iron Horse. What's the other one?
The other one is the next item. That would be that's property out at the airport. That would go to
That's the one for the driving trains. Okay.
And that's the next item.
Okay.
That list, or the one you sent us, there's not 61 on there. There's only about 10 on the 2 pages. And maybe it's all the ones that were on with the city in Scotland, but I don't see a list of.
Still not 60.
No. Because every one of these show Scotland County and the city of Lawrenceburg.
Okay. There are additional in the drive that just were not attached into the list.
Well, since we're talking about that, the old State Bank building, Walkover building downtown, did somebody purchase that already, or like somebody was putting windows back in it? So
I know it was, I've not looked recently. I know it was transferred back during the summer. Okay, somebody has transferred, and I know someone was putting some work back into it.
So somebody bought it or did whatever. I'm just curious. I saw somebody was putting windows back in, so I was glad to see that.
Well, you finish. I got one more question.
But with that,
Does the board need to see the other items?
if the board, I think, is scheduled to recess until next Monday for the broadband discussion with the COG. If it's okay, I will go off and I will make sure you get the complete list and just table this until then.
What time is the meeting next?
10 o'clock
Here at the county.
here.
Is that open to the public?
Yes,
They're talking about broadband.
yes. It's talking about the broadband study that has been done in the region.
The results of all the surveys that were done, you know.
And they'll be talking about the Scotland County results. And if you go into the Google Drive for your account, December, the 06-1 December meeting, that already I believe that already has a presentation for next week.
Okay.
Okay.
And I'll copy the tax listings into that file also.
Okay.
The other thing is one of the properties that has been foreclosed and is in the county's name is approximately 7 acres. Go ahead, Charlie. Inside the blue outlines, the county owns those 2 pieces of land on either side of Charles Craft Road or Charles Craft Lane. The property on the north side in yellow, that property would be my recommendation that the county transfer that to RCC. That is the property that the RCC has gotten has received approximately $1.5 million for the creation of a truck driving school. And this property is where they would actually do the on-site driving or the parking lot driving portion. The part on the right side of Charles Craft Lane, just in the blue box, that is surrounded. That would be part that I would recommend go to Warrenburg, Maxton Airport, or Southeastern Regional Aviation Authority. That would become part. They own the rest of that triangle, which would be a 30-acre industrial site. That has the potential of being rail served as well. So that can easily be developed into a prime industrial site for the airport. The top portion of the yellow triangle outside of the blue is currently owned by the airport. And airport would transfer that property also to Richmond Community College, so that would be all one part of their driving school. Under the legislation for the funds that they have for that, the community college needs to own the land before they can use those funds for capital improvements. Otherwise, they have to go back and get special legislation to be able to use it for rented property. So that's why we are looking to transfer those properties into RCC's name. The airport will basically either charge a $10 fee or effectively nothing to RCC. Basically, we will be swapping property so that they will have that, and then LMA will have a potential complete track for an industrial site.
Okay.
So
Aren't those
everybody
structures
gets
on
something
the
except for the
property?
county.
Sound like
There are, most of that is just concrete. There is one building there, which is part of an old way station.
Oh, okay. Mhm.
But again, everybody gets something out of this but the county.
Yes, sir.
Well, I think we're getting a facility to the driving school, which is part of RCC, to locate in our county rather than them locating it in Richmond County.
Don't make anything off that. I mean, it's not
And also
not any job created out of it, or I mean, I'm just curious as to why they can't buy it from us for maybe a reduced price, but you know, everybody getting something out of this but the county here, and I don't know. I don't know how I feel about that. I ain't had time to digest that.
And I think maybe I misunderstood when you started, but the track in the blue square belongs to the county.
Yes,
And are we deeding that to the airport authority?
yes,
So they will deed the other part,
yes. They would deed the other part to RCC.
the other part of the yellow.
Top part.
Okay.
Yeah. Because the other blue line is we own, right?
Yes, sir.
Now it's the top part.
across the street.
Yes.
No, and on the yellow.
We own
Middleway.
this
Oh, okay.
portion, and we
And
own
that,
this
yeah.
portion.
Got you.
So basically, we would be swapping this portion, this wooded area, for this for RCC.
it is a kind gesture. I mean, if that's what we want to do. But I'm like Commissioner, it's hard to.
Well, that and also the community colleges are somewhat like the school systems. Their capital funding comes from us. So if they want to buy property, they come to us to buy the property. And the funding from the state budget is not specifically for the allocation. So the only ones that we could get funding from is the airport.
I don't have a problem. This ain't gonna benefit the county at all. There's not a job involved in it. It's not gonna be on the tax books. If anything, it'll cost for infrastructure support, for fire and police support and all that good stuff. I'm not against, my problem is,
Won't we benefit from the truck driving school from the tracks wherever we take?
that's what I'm saying, we won't. We're not gonna get any jobs out of that.
I mean,
Our county residents.
well, truck driving.
It may help our employees get
Yeah.
jobs.
It's good to have it.
Citizens.
I'm not saying, I know that, I know, but I mean, that site is not gonna have a job. The folks that are gonna teach that are coming from out of town or already teaching it, or it's not gonna develop it.
I get
You understand what I'm saying?
Oh, I do, but I mean, so
I don't think it's a bad idea,
it's a kind gesture. I mean, because it puts it here in our county, as he said, rather than Richmond.
Well, and I think the drivers the people in Scotland County who might want to go to that school are more likely to go to it if it's in Scotland County than if it's at the industrial park in Richmond County.
I've had friends that had to travel so far distant to truck driving school. So
80,000 truck. They need additional 80,000 truck drivers.
So maybe we're having a good cause, maybe.
I'm not against.
Yeah, let it roll.
Well, the chair would entertain a motion for us to move forward with the proposal as presented by the county manager.
You asked for a motion?
Please.
Yes,
I'll second.
follow through with this.
I have a motion from Mr. Alford and a second from Commissioner McCall. Any further discussion? Hearing none, all in favor say aye. Aye.
Aye.
Any opposed say nay. Ayes have it. Thank you very much.
Okay. The other two items, January board meeting, the January water board meeting. The Board of Commissioners will be meeting at 6 o'clock. We normally meet for the January and June water board just before that commissioners meeting. So ask that the board set the meeting date. The question is, would you want to meet? This may also start at 6 o'clock and just join at both boards simultaneously, or meet at 5:45 at the water board and then adjourn the meeting. That meeting normally takes, it's a review of financials and does not take.
I've always felt that was doable. I think we ran into a situation where there were one or two citizens who basically criticized that process, but it's the same group, just with two different hats on. So if the board prefers to do it at 6, I think that's fine.
I have already advised the ABC board of our new meeting time, because we met tonight at 5 o'clock here. And, but we don't think the 6 or even 5:45 would be a problem. We normally don't take 20-25 minutes.
Anybody have any opposition to us doing it at 6 o'clock?
Sound me
Sounds me.
better than
good to me.
5:45.
5 o'clock, you better.
Put all at once.
Fine.
Okay. And the date of that meeting is?
January 3rd.
That's our next meeting.
Yes, sir. The other thing, and this is just for information, last month, the board authorized me to execute the settlement agreements for the opioid case after review by attorney. Those documents, Ed did receive, we received the hard copies last week.
Right.
And then he provided them to me. I executed them and transferred and sent those back up to our national
And,
attorney.
and they were reviewed by Jake Daniels with the law firm that we engaged
Yes.
along with a lot of other counties.
So those were sent back up. They've been reviewed by national counsel also. So those have been filed. And that is just an update.
Okay.
And that is all I have.
County Commissioner comments. We do have a closed session to go into, but we'll go to the County Commissioner comments before we do that. Commissioner BJ Gibson, any comments?
No comment.
Commissioner McCall?
No comment.
The only thing I would ask is and I thought maybe the 13th, but we need to go back into that special closed session like we were, and we never did get a date on it.
Well,
Because I know everybody
yeah.
was traveling and all, but
Well, we can do that.
Okay.
As what we had, if you remember, on November 18th, we kind of continued it, thinking that we would meet tonight. I think Jay Gibson and Mr. Ivy suggested that instead of adding a long session after this, I think it was a great idea. I put out some feelers and we couldn't find a date, the 7th, 8th, or 9th. So at this point, does anybody have a suggestion for that date? I think Tuesday, Wednesday, and Thursday of this week are out.
if we're all gonna be here the 13th,
Monday.
yeah,
Monday.
why not?
I'll be late
I mean,
for
because
that.
I don't think that's gonna
Was it
be
10?
that long of a presentation.
If that meeting would be at 10, have closed session scheduled at 11 o'clock.
Maybe
Mr.
through the
Johnston
court by
has
then.
a
Court session that morning.
child support court or something. That's,
Yes, it is
he told me
child
today that
support
was the only date he knew he had a conflict. Do you know
court. I'll
when you
probably be
might be
through by
free?
lunch. Normally be through by lunch.
What did you say, Mr. Johnson?
He said,
Said it- Normally we're through by lunch.
would you think you'd be through by 12?
Yes.
1 o'clock then.
Well, can we try to convene? We're going to meet at 10 for the broadband, come back at 12. Mr. McFadden, I know you have a hard time.
I'll try to make it.
Anybody else know they have a conflict with that day?
So we're talking about,
I was just trying to
13th.
keep it all in one day instead of having to make two.
Saying 12 o'clock on the same day, we're gonna be there at 10 o'clock?
Yes,
for
ma'am.
2 hours,
Well, the first meeting will probably take the first hour.
and we have a free break.
And
then
you
we
got to
come
break
back.
for an hour and then come back.
It's Monday.
Or we can come back another day. It makes sense to me to try to do it all on that same day. Anybody have any any problem with that? Let's plan to reconvene that closed session then at noon that day. Mr. Alford, you have any,
I'll have a problem.
you have anything
No,
you'd
I
like to
don't have
report?
anything tonight.
We need to collect, if you call me, we need to collect make sure all the commission turn in their recommendation for the award. And we also need to set a time to do the award.
Okay,
You know what I'm talking about?
Yeah, the ones I turned mine, Jason.
The
you got
heroes?
mine.
Yeah, the heroes.
The hero.
Is everyone familiar with, Ms. Golston handed out a sheet that each commissioner was to make a recommendation for an award
For a hero award.
in regard to the activities regarding COVID in the last 2 years. You should have gotten that. Has everyone turned theirs in to Jason?
I have not.
Okay.
I will.
If you have not gotten that form or have not turned it in, you need to see Jason.
What is the process thereafter?
That we need to set a date when we're gonna give the award.
And what are we giving them? A certificate or
Flag.
a plaque?
And I kind of thought we were going to do that at the January meeting.
That's what I thought.
Yeah, when we talked about, did we say for sure we're gonna do it in January?
Can you get the plaques
Let's do
made
it
by
for
then?
January.
I think the question was if he could get the
If we
plaques
get the
made.
plaques ready, that was
Yeah.
the question.
So you have it from everybody but Ms. McCall right now?
One more question is, do we invite the families to come? Give you an award?
I would think so.
Okay, so you think that we need to, how we need to get that information to them, so they know, or leave it to each commissioner
First, get
to
it to the
tell
one
the
they turn
people,
in.
yeah, the family to come.
I think it would be nice if a formal invitation was sent from the board as in, to that person and their family,
Right.
rather than me saying, "Hey, we're gonna recognize you. Come." I think something more formal should be
Okay,
sent. My
that's a good
thoughts.
idea.
Jason, can you work on that letter?
And one more thing I want to say, at some point, at some meeting, we're not so tired with so many things. Can we at least talk about a homeless shelter for Stockton County?
And the only comment I was going to make, the same thing that Mr. Ivy was make sure we had that meeting planned.
Can I respond to Ms. Costa? If you would talk to Commissioner McCall, she and I were involved with a group that's trying to do that. And if you would talk with her, she can bring you up to speed on that.
Okay, thank you.
How about family farmers?
Yes, sir. Yes, ma'am.
Okay, and any other comments from commissioners? If not, do I have a motion to go into closed session pursuant to North Carolina General Statute 143-318 to consider the qualifications, character, fitness, conditions, appointments, or conditions of initial employment, an individual public officer, employee, or prospective public employee, or to hear or investigate a complaint, charge, or grievance by or against any individual public officer, employee, to discuss matters regarding the location or expansion of industries or other businesses in the area served by the public body, including agreement on a tentative list of economic development incentives that may be offered by the public body in negotiations, or to discuss matters relating to military installations, closure, or realignment. We have
So
that motion.
moved.
We have that motion. Do we have a second?
Second.
Have a second,
No,
Mr.
no,
Alford. All in favor, say aye.
Aye.
We are in closed session. We are going to closed session.
On the personnel component, Mark's not gonna be in here.
Gracious.
They asked about it.
Well,